Hey, good evening folks, Dr. McCarthy here, and tonight I'm going to give you some very, very important life-changing information. If you or someone you know and love is dealing with chronic health problems involving digestive issues, food sensitivities, or neurological issues like chronic pain or cognitive decline or early onset Alzheimer's, tonight this is game-changing information. We're going to talk tonight about the gut-brain connection. There's a colleague of mine, Dr. Dana, out in Raleigh, and she put up a great post on her Facebook page today, and that prompted me to say this is what I want to talk about tonight. There's just so much information about this now, the gut-brain connection, where I would talk about this 10 years ago, and nobody knew what I was talking about. Now I sit down with patients and I say, okay, did you ever hear of the gut-brain connection? And most folks are saying, yeah, I did. I don't really know what it means, but I've heard about it. Tonight we're going to talk about that, and I'm going to let you know, the things that you need to know, and I'm going to give you some inside secrets, and I'm going to let you know things that you can do that will help you to change your life and to help to improve your gut function and your brain function. Help to preserve brain function so you're not one of the many millions who are dealing with early onset dementia, cognitive decline. We used to think years ago, like back when I was in school, that the gut had one function, the brain had a separate function, and that they really weren't interconnected. But actually, there is a bundle of nerves that, first of all, we all know now, if you've been watching my videos for any length of time, you know that the brain controls the function of every cell in your body. So it's actually the brain that's telling your gut what to do, specifically the vagus nerve. And I'm going to talk more about that. Let me put a note up here so I don't forget to tell you about that. This is an absolute game changer in our office, and the folks that we do this with are actually able to get their lives back again. Folks who were told you need to have sections of your intestines cut out and you need to take, anti-immune system drugs to really just destroy the function of your immune system. When we add this therapy into our treatment protocols, we're able to see folks who can cancel surgeries, don't need to have their intestines cut out, and don't need to take these heavy-duty immune system drugs. But if we get back to this, the brain controls the function of all the cells in your body. Your brain controls your gut through your vagus nerve. But what we've learned in the past 10 years or so is that the vagus nerve is actually a two-way street. So the gut is sending information up to the brain about what's going on down in here. So the information is going in both directions. And when you have a healthy vagus nerve and that highway is flowing freely, in both directions, that's when you've got really good brain function and really good gut function. Most folks who are dealing with chronic health problems, and any kind of chronic health problem, fibromyalgia, thyroid, autoimmune problems, neuropathy, migraines, chronic pains, any of these issues here, we usually find that there's an issue with gut-brain connection. Most folks have a problem with gut function, and many folks have brain issues that they don't even realize are issues until they come into my office and have the proper neurological evaluation done. And our neurological evaluation is extensive. We do a lot of different testing that enables us to determine which areas of your nervous system aren't functioning up to par. So we work on people, again, another phrase that you've heard us say 1,000 times, we work on people neurologically and metabolically. Metabolically meaning how you turn your food into energy. That happens inside your gut. So if you can turn your food into energy very efficiently, and your brain, all areas of your brain are firing on all cylinders, that's the definition of health to me. Most folks dealing with chronic health problems have issues in both of these areas, so we need to work on both. We need to work on you neurologically and metabolically. One of the things that we talk about all the time is proper gut function, is digestion, as far as the level of acidity inside your stomach. Inside your stomach, you are supposed to be very, very acidic. And most folks that we see here over the years have become very alkaline. There's not enough hydrochloric acid in the stomach for you to digest properly. And if that's the case, You cannot digest your food, it stays in your stomach, it putrefies, and it produces lactic acid, which bubbles up into your esophagus and gives you that heartburn, reflux, whatever you want to call it. Those folks the TV commercials do a fantastic job of making you think this is the issue, that there's too much acid in your stomach. So you take their magic pill, and once you swallow the pill, little firemen jump out of that pill, and they take their fire hoses and they put out the fire because there's too much acid. Theoretically, that makes sense, right? You feel like your stomach's on fire, they tell you there's too much acid, you take the pill, it puts out your symptoms, everybody's happy. Well, you're happy because your symptoms have gone away, and the drug manufacturers are even more happy because they've got $1 billion industry. You know, I don't even know, tens or hundreds of billions of dollars are spent on these worthless drugs that do nothing, but they probably make your problem worse. You know, at worst, they're not fixing you. So the longer you have a problem and you're just covering it up, the worse it's actually becoming. Number one issue that we see in folks who are dealing with this reflux, indigestion, heartburn, GERD, whatever you want to call it, number one is an infection. And it's a simple infection that can be taken care of. The issue is that the conventional approach to folks who are dealing with this is, here's your prescription, as opposed to, hey, let's do a simple test to see if you have this infection, and if you do, let's kill it, so your problem goes away. Then what we need to do is actually take a digestive enzyme, which does two things. It helps you to digest your food properly so that you can turn your food into energy, right? The metabolic side of things. But secondly, if you've got proper digestive enzymes in your stomach becomes very acidic. And when you're acidic, the bad infections cannot live inside your stomach anymore. That's what we do here in our office. We fix problems. We're not trying to cover things up. So, you know, if you're dealing with chronic neurological problems and nobody's addressing your gut, we can't fix your neurological problems. That's why people wind up in my office. They've been everywhere. They've tried everything. We had a wonderful woman came in yesterday where I sat down with her maybe 2 months or so ago and told her, you know, here's all the things that we need to fix. Her gut was terrible. I mean, terrible. And so I told her, hey, this is what's going to take. You know, you're going to have to do dietary changes. You're going to have to do lifestyle changes. You're going to have to come into the office so we can do neurological work here. And it's going to take time, and it's going to take effort. And you know, it's going to cost money. Your insurance doesn't cover everything. And she was dismayed, you know. She said, oh, I don't know if I can do all that stuff. And fast forward 2 months, she came back in just yesterday and said, well, I'm worse. I don't have any choice now. I've got to do this. So we are setting out. We chart the course, and we're saying, okay, here's the 3 or 4 things we need to do to fix this. Here's the 3 or 4 things we need to do, and we start doing it. We're going to start next week with her. Now I get very excited when somebody raises their hand and says, "Yeah, sign me up. I'm ready to do this," because I know where that person's going to be 6 months down the road. I know that not only are we going to fix her gut issues, but we're going to make her brain function at a higher level than it is right now. What also worries me and keeps me awake at night, no, I'm just kidding. I don't stay awake at night. But what bothers me is folks who I know I can help. And I know that there is no prescription medication that can cure these chronic neurological or metabolic conditions. And I tell them, look, here's what it's going to take, and it's going to take hard work. And they say, yeah, I can't do that, you know. Thanks, I'll see you. And I know where they're going to be 6 months down the road, in worse shape, causing more neurological demise, neurodegeneration. Their brain function is going downhill. And they say, well, it's not too bad. You know, I eat whatever I want to eat, which means crap. I eat crap. And I just pop my little purple pill. And they think that's the cure. Meanwhile, their brain is degenerating at an accelerated rate. You know, I just want to show you a quick picture here, and Michelle will tell me when we can see this. Can you see Gut-brain inflammation? This way? Okay. Gut-brain inflammation. What we're talking about here is there's a gut cell and there's another gut cell. And you can see up in here, that's a tight junction. The cells that line your intestines. And they are tightly joined together so that only small little small digested proteins can get into your circulatory system, nutrients, vitamins, minerals, so that they can get carried where they need to go. What happens most times in folks who are dealing with food sensitivities, and there's a whole list over here, stress, infections, drugs, antibiotics are a big cause of this, fluoroquinolones specifically, enzymes or lack thereof. There's a whole bunch of different things here that can create this inflammation. And when the inflammation happens, that's when you get the tight junction opening. All right, so now there's a large gap between cells. Can you see that still? When you get that large gap between the cells, that's what's called a leaky gut. So now large undigested proteins can get through into your circulatory system, large proteins that have never been seen before by your immune system, and it sparks more inflammation. And so now your immune system says, I don't know what the heck that is, but we must tag it, create antibodies, attack it, kill it, and you get things floating around like prostaglandins and leukotrienes and nuclear factor kappa B, and you don't even need to know these things, but you get all these chemicals that float around that creates inflammation. And when you develop a leaky gut, at the same time you develop a leaky blood-brain barrier. And now you've got cells from your immune system and inflammatory chemicals floating around inside your brain. So you think, it's just a little upset stomach. And I know what's going on inside your brain. This is what bothers me. So if you're dealing with gut issues, it's not just a gut issue, it's a gut-brain issue. If you're just dealing with brain issues, my memory's not as good as it was, and I walk into rooms and I forget why, I got brain fog. People think that that's not a big deal. Yeah, it's a huge deal. And you've got a leaky blood-brain barrier, you got gut issues too, you've got inflammation raging inside your intestines. The good news is, this is fixable. The bad news is, you have to come and see me so I can fix it. I haven't met anyone yet, maybe I will someday. I haven't met anyone who's walked into my office and said, hey, you know what, I've watched your videos, so I stayed home and for the past 6 months I fixed myself, so now my memory is great and I'm sharp as a tack and I don't take any pills and I'm digesting well. I wish it were that simple. If it was that simple, I'd be laying on the beach all day making videos telling you how to do this. But you got to know what's going on. Now, we work on you neurologically, we work on you metabolically, and one of the many things that we do is, this is a real game changer, transcutaneous vagus nerve stimulation. All right, it's really cool. We're working here, but this works here. Remember, the connection between the gut and the brain is the vagus nerve. So we can actually do stimulation to impact the way your vagus nerve functions. And now we're seeing incredible results with folks that are dealing with anxiety, depression, poor gut function, indigestion, brain fog, insomnia, mood issues. It's just amazing. But you really can't play around with this stuff. You have to know what you're doing. The way we work it in our office is when someone signs on as a patient here, we will do vagus nerve stimulation with them here for the first 6, 8, 10 visits, whatever, to make sure you're doing it the right way, make sure you're not having any adverse reactions. Any adverse reaction that you get from this is a temporary thing. Like, you might feel a little dizzy for 10 minutes or something. It's not life-altering stuff. But you need to know how to do this, and we set you up with the unit. And then after you've done it here in the office for a couple of weeks, we'll say, you know what? Take this home. You're going to go home and do it every single day. So just imagine the kind of changes we're getting in folks now who are now doing vagus nerve stimulation every day, not just when they come into our office. Those are folks who are improving their gut and their brain function every single day. And it's not a drug, and there's no bad side effects to it. This is a game changer. So again, just like we do every Thursday night, we talk about this stuff, and then I give you the opportunity to find out if this can help you. So what I need you to do is put your comments down below, ask any questions that you have, and as always, we offer a free consultation, free 15-minute consultation, where you can come into the office, sit down face-to-face with me, ask me questions, I'll ask you questions, we can see if we're a good fit for each other. And what you need to do is call the office and talk to Michelle or Alicia, tell them you watched the video, you want to set up time for a free consultation. I'd be more than happy to do that. Or if you have any questions, post them down below. I'll put my phone number up, but if you're paying attention right now, write it down, 758-2222. I'll put it in the comments after I upload the video, and I'll get to your questions hopefully later tonight. But anytime that we can do this for you, let me know, call, over the weekend, leave me a message, we'll call you back. If you found some value in this video, if you think that this is important information, please share it. Feel free to share this wherever you like. There's 4 or 5 people every week who share my video every single week, and I love you guys, I appreciate it. But anybody can share that. And then also like it, love it, whatever you like down below as well. But if you're sick and tired of being sick and tired, take action. We have countless scores of people. Go look at my my YouTube channel, Dr. Robert McCarthy. Hundreds of folks who have testimonials on there about how their life was changed. Life was horrible. I saw Dr. McCarthy for a couple of months. Life's not horrible anymore. I feel immensely better, and I'm off drugs. That's what we want for you too. So the first step is give me a call. I look forward to working with you. Thank you very much. Have a good night.